Why don't we go over the benefits of testosterone replacement therapy?
Yeah, sounds good.
You know, so commonly asked question, isn't it?
Yeah.
Let's break it down nice and easy.
Yeah.
So fundamentally, it's about reversal of negative symptoms.
Yeah, absolutely.
Low mood, is TRT gonna cure your low mood?
So it'd be nice if it did, but it's not going to do that on its own. It's
Yeah.
going to allow you the ability to do the things that's going to reverse low mood. And that can be something as extreme as, I don't want to kill myself anymore. Or it could be, actually now I'm engaging with life, not just allowing life to just kind of happen and pass me by.
Yeah, absolutely. We know that obviously we've successfully got a lot of people off of antidepressants. So we know there's a relationship between testosterone and low mood because of the testosterone's relationship with dopamine, estrogen with serotonin, DHT with GABA. So it is complex, but yeah, fundamentally, low testosterone, normalizing testosterone levels will positively impact it, but it's down to you.
Yeah.
Tiredness.
So yeah, it's another one where it'd be great if it did fix it. And I suppose to a degree you could argue it's helping with that on its own, but your sleep's probably going to be better because you're doing the right things in the day to allow you to get good sleep and be rested psychologically and physically.
Yeah, tiredness. There's over 100 causes of tiredness. Again, yeah, low testosterone does cause fatigue. Normal testosterone levels, again, the foundation. Look at your sleep, look at your stress, look at your nutrition, look at your exercise, look at your mindset. Get on with it. Brain fog.
Experiencing that now.
Yeah, does testosterone replacement therapy cure brain fog? No.
Yeah. Yeah, it's going to be a similar answer to a lot of these, isn't it? It's just it's the foundation to allow the capacity to fix these things. Now, yeah, there is that clarity you're going to get particularly with things like HCG in the mix as well. But again, it's doing the right things in the day that's going to allow you to be clearer, be more focused, be more confident in situations, and it all feeds into the same thing, doesn't it?
Yeah, brain fog's a fascinating one, isn't it? Because again, it's one of the cardinal presenting symptoms, you know, where have I put my keys? All of these sort of strange, sort of insidious things. But testosterone, estradiol, DHT, they all have an impact on the brain function and subsequent neurotransmitter function. So yeah, it will help. It won't make you a member of Mensa, but it's going to allow you to function how you can function, assuming, here we go again, sleep, stress, all of these things, yeah. Libido.
Libido, it's definitely...
Are you going to have a libido like you're 10 years younger?
Maybe if you go to some places, but 15 if it's the men's health clinic. No, so again, it's the same. I mean, we know even with guys that are dialed in, if you're super stressed and not sleeping, libido is going to dip. It's going to be one of the first things that does dip. So again, unfortunately, it's just the similar kind of answer where it's going to allow you to do the right things for that to become something that's normalized. Yeah, obviously testosterone is linked in with the things like libido and sexual function, but it's not a fix-all on its own.
Yeah, it would be nice, obviously, you've got low testosterone, you feel miserable, but everything affects everything. And libido is probably down the list because again, you need to survive and survival is key and survival's cortisol. That's counterbalanced with testosterone. But if you've got low testosterone, that's a problem. Normal testosterone, again, will allow you to have a libido, but reduce those things like stress. How are you at the weekend? If your libido is good at the weekend, great, but you can't expect to be horny goat boy all the time with the weight of the world.
Yeah.
It's crazy, isn't it? But having a reasonable libido is obviously necessary to keep us guys happy.
Yeah.
Weight gain.
Yeah, weight gain is an interesting one. So a lot of new patients who are doing the right things a lot of the time are struggling with distribution of body fat and basically not getting proportionate response in terms of how they look and body composition relative to what they're putting in. And that does come down to hormone profile to a degree. But again, yeah, you will get, when we've seen you do get incremental small improvements if you're not really doing much, if you've got a normal physiology, because you've got a normal physiology. But again, if you've got a normal physiology and you do the right things, you just get out what you put in.
Yeah, a guy today, he's lost 40 kilos in a year.
Yeah, incredible.
So he's been on it like a car bonnet.
Yeah.
Literally calorie deficit, So a constant stress state, which is why his libido, his only complaining factor was everything's perfect apart from a libido. But he's in a chronic stress state. So he's lost 40 kilos. So now it's time to go back to maintenance. He's training, he's doing all the right things. It's all about balance, isn't it?
Yeah.
Always.
Always.
Yin yang. Here we go again. So that kind of ties in again with lean muscle mass as well, because obviously, you know, when you're obese, you're not firing all cylinders, you're not doing the right things because you can't do the right things. And guys don't complain of a loss of lean muscle mass, they complain of a loss of strength, don't they?
Exactly, or kind of what we were saying before, that I just don't feel like I should be looking and feeling the way I am given what I'm doing, which is fair, because it's an uphill battle, isn't it, when you've got normal physiology that's doing the right thing. Yeah,
I think it's about achieving your genetic potential and perhaps slightly surpassing it because you're on testosterone replacement therapy. But we had a patient recently who said, you know, when I go on testosterone, how many pounds of lean muscle mass am I going to gain? How did you answer that question?
I didn't answer that question. I said that doesn't. You're focusing on the wrong things. It doesn't matter. It's about the big picture. Yeah, that will improve, but don't focus on that.
Yeah, you're not going to turn yourself into Arnold Schwarzenegger because you're not Arnold Schwarzenegger, but you can achieve your genetic potential. How many pounds of lean muscle mass that equates to? Listen, focus on form and function, and you know, cliche, be the best version of yourself, and you'll be the best version of yourself. We're so focused on quantitative numbers, aren't we, as men? Tunnel focus, constantly. Actually, just look at everything, get on with everything, appreciate the moment, bing, bang, bosh. That's what it's about.
With the thousands of patients you've seen, obviously now, do you see a difference in what new patients coming into treatment want versus what that same patient wants or values from TRT 12, 18 months down the line when they're dialed in?
I think, again, fundamentally, it starts off as reversing the negative symptoms. And it's like, yeah, bing, bang, bosh, testosterone replacement therapy is not going to do that in isolation. You have to work on all these things, which is why we counsel patients so much. And again, then a year down the line, 2 years down the line, it's that cliche, it's about being the best version of themselves. But you know, you've seen this in the annual reviews, you know, life isn't always peachy. So they come in and they say, I'm coping with life better than pre-TRT. Life is stressful, and again, TRT gives you that ability. You know, the fundamental symptoms, irritability, we don't often talk about that as a low testosterone symptom, but when you're on testosterone replacement therapy and a well-balanced protocol, you're less irritable, you're more tolerant, you're nicer to be around. You know, I'm sure Lou will have made comment.
You will say yes.
Because you are feeling more balanced, and then you're going to be more considered because you're not in that constant fight-flight state, are you?
Yeah.
You know, this is right. How do I see a problem? How do I tackle the problem? Let's get on with it. Yeah, I think it's interesting. TRT offers hope. Again, I had a diagnostic call today, and the guy broke down in tears, and it was like he was so relieved that we were going to help him. He'd reached out to the GP. You know, he'd shown due diligence, he'd been working all these things, and he still felt like something was missing. And it's heartbreaking. Lots of these guys are suffering needlessly because of a lack of understanding and awareness of what is actually testosterone deficiency and what can I do about it. You know, we see it all the time, don't we? Just, they get a closed door from the GP, they're despondent. And again, testosterone allows them to cope with the stresses and strains of modern life.
Yeah, I think it's important that we're involved. It is on the patient a lot of the time, but it's important for us to help turn that hope into a motivation to get the ball rolling and use TRT as a platform to go and do all these things we're talking about.
What's the saying?
What does it say?
Your reward. Literally, give them the tools, give them the platform, and get them to fucking put the work in themselves.
Yeah, exactly.
Because again, it's not our journey. You know, it's their journey.
Yeah.
What they can achieve is whatever you want to do.
Yeah.
We just come back from Mont Blanc, and a couple of the guys we did interviews with, and Colin said, I said, is there any moment that you're going to feel like giving up? And he goes, no. And it's like, firm no.
Yeah.
But 5 years ago, yeah, perhaps with low testosterone. And that's miserable. And then, what did Paul say?
You asked him, I think you asked him if he'd ever considered doing something like that before TRT.
Yeah. Oh, no, Pash. Yeah,
Right,
so have you ever considered doing a trip like this before?
Yeah.
No, you wouldn't even think about it.
Yeah, that was great. That was really good.
So it opens up opportunities because your mindset is there going, what can I do now?
I mean, that's life-changing. That guy's living a different life as a result. It's fantastic.
I suppose it's all about seizing opportunities and appreciating the moment. Nothing more, nothing less. And, you know, as cliched as it sounds, being the best version of yourself. And ultimately, we provide the tools, we provide them the foundation, but it's down to them.
Yeah. I think building off that as well, I wouldn't delay things as well. If it's something that is in the back of your mind, get a blood test and get it checked, because otherwise life is just passing you by and you only here once.
Yeah, with low testosterone, you're in that purgatorial state, and you don't know how good life could be, and that sounds like a sell. But again, if you approach us, you're going to get an objective, truthful opinion. And people often thank me for saying, you don't need to go on testosterone, you need to work on that.
Yeah, and the insidious nature of it is it doesn't happen overnight. So you get used to just a kind of flat baseline.
Normal.
Yeah, you get used to a rubbish normal.
Yeah. And it's like, well, no, let's go to the new normal, which is the normal you should be experiencing.
Yeah.
Yeah.